Hello everyone, welcome to the 76th episode of Unboxing AI webinar by Carpool. This is our weekly series. As you know, every Thursday, 11 a.m. Eastern, we go beyond the buzzwords and unbox different sides of AI in radiology, in healthcare, and medical. And for those of you who don't know what Carpool is the world's largest AI marketplace and an end-to-end enterprise imaging platform which allows you to build, test, validate, and clinically deploy AI in radiology. So today I'm very excited to have our guest, Felix. Felix, thanks for coming on to the webinar. I'd like to quickly introduce Felix. Felix has a PhD on the brain basis of Alzheimer's and has done other imaging work in neurodevelopmental disorders. He was the first one to publish on AI system for predicting clinical trial outcomes and has worked as an analyst in radiology AI. He's a business coach for healthcare sector. And when manages to find time, he hosts the Medical AI podcast, I think, which is how I know Felix. And it's an amazing tool where we get to hear about different aspects of what AI is up to. And I think my first question, Felix, is, what is the coolest and the most unexpected thing which you have experienced, you know, in your medical AI podcast? If you can just tell us, like,
Yeah, that's a great question. It's a bit difficult to choose. That's a bit like asking me to choose between my children, because but I think recently I've decided to just throw caution to the wind a little bit and get a bit more outrageous and provocative. And so, I say to my guests before they come on, the number one commandment for being on the podcast is be sexy. And so, I've had a famous artist on recently who was talking about the dangers of AI systems for mental health. I've had somebody who has an AI system for what he described as a cock ring, and that was for diagnosing heart conditions as well as sexual function. And I think probably though, in terms of my most recent ones, my favorite is probably somebody who was from a company called Realbotics, and Realbotics have become they've got a really high profile with the media because they are the people who have produced what they describe as a hyper realistic android robot. And it can't do very much. It's not like Elon Musk's Optimus, but it can speak, and it is kind of like an animatronic, almost perfect kind of humanoid. So they describe that also as a love robot or a companion robot. So these are marketed for people who might be lonely and need a bit of company. You could argue whether that's really medical AI or not, but it's really intriguing because I think it goes to a very interesting and fundamental question about, how AI systems are going to affect our human relationships. I think it's something that, to watch out for in the next 20 years. We could have a complete overhaul of what it means to be in a relationship. And apparently there are places in China and Japan where it's not actually that abnormal to see people in a restaurant sitting down with their robotic partners. That's what I've been told. I've not seen that, but I can well imagine 10, 20 years hence, that might be quite a common sight, wherever you go. So I think I would have to go with the love robots.
oh my God, that's like a very different start to our,
Yeah.
conversation. But I would like to know, like, more about, what clinical roles do you think humanoids will benefit, and what parts of medicine will remain as they are today?
Um, Great question. All right. So look, the reason that I think humanoid robots is such an interesting question is okay, let me preamble that with a couple of points, right? First of all, very recently, Elon Musk
Yeah.
stated during his presentation to investors in Tesla that Optimus was going to be the single biggest product in the whole of human history, right? And now Optimus is an Android robot that has spectacular capabilities. It's not on general release yet. It's going to be released, I think, probably March 2026. And it can break dance, it can kind of do kung fu, it can supposedly put your washing away, and it has all these kind of capabilities. Now, clearly, no doubt the first release is going to be limited in all sorts of ways, and there are going to be probably lots of videos of people pushing it over or abusing it on YouTube. So getting past that, however, I think it's a really, really interesting question and a very much under-discussed question. What does that have to do with the medical field? How will Android robot or androids I think for politically sort of correct reasons, they now tend to be called humanoid robots, right? But I'm just going to say androids. So how do androids have anything to do with the medical field? It's a really, really interesting question. I think the short answer is we don't really know yet, but we can take pretty good guesses in some fields. Like imagine, let's think about you know, if we can think about 9/11, okay? We had firemen going into burning buildings or the twin towers, trying to rescue people from the rubble, and then had the building collapsed on top of them. We could think of other examples too. That's clearly so. I think paramedics is one area where humanoid robots could be really valuable. A less spectacular example, but something that could also be really important is just care of the elderly, helping elderly people around the home. Is that medical? It could, it's a sort of a gray area because it could have all sorts of medical impacts. I mean, I think my mum is, for example, less likely to suffer from back problems if she didn't have to move, boxes around her house, right? See what I mean? So I think, but you can also think of other applications as well. I can well imagine that robot physiotherapists could
So
be
mostly in the
helping people.
operational and like support roles, not really on the clinical side.
Well, I think that's a question of time. We don't really know. And I think probably the most spectacular example of humanoid robots being involved in medicine is that of surgery. Now, if you think about it, I mean, I think this would be a really interesting test case. And also, when you ask about, okay, are they just going to be helping or are they going to be performing surgery? Well, that really just depends on time scale, right? Because no doubt initially they will not be performing heart surgery. 10, 15 years time, who knows? I mean, if I look at my hands,
Correct.
I think, I can play the piano and I can type on a keyboard and I can do all sorts of amazing things with my hands, but they are basically at the end of the day just 10 sausages on a sort of stump, right? And they are this big and there's no way that I can make my fingers tiny and perform, like microsurgery on nerves or small blood vessels. Maybe robots can do that. So it's not just a question of whether robots could perform surgery, which, to a level of surgeons, maybe they could perform whole new types of surgery that we haven't even really properly thought of yet. So I think, that is
Yeah,
that's the
because
humanoid
like for
robot.
complex surgeries, we definitely need situational understanding of what needs to be done. And I don't think so if humanoids can achieve that in the next 10 to 20 years. And again, as you
Look,
said,
I'm with you. I would, but I'm skeptical that we will see that in the next 10, 15 years. But at the same time, people's expectations about what AI systems can do are constantly being overturned, right? And so, I'm somebody who is skeptical, but I'm also open to my skepticism being
yeah,
disappointed, and I love it when that happens. And I think that happens all the time already, I think.
right, right, right. And so, talking about radiology AI, right? So, do you think that right now in this field, radiology AI, like all the AI models, do they, act as Google Maps, which is more of, a navigation and the person
Yeah.
can choose to accept the route or not accept the route, or is this like, just a plain on autopilot mode? What are your thoughts on this?
Well, look, we I think the reason that we don't have much in the way of autonomous AI systems at the moment
Yeah.
is not so much because of the technology. It's in the same way that it, sometimes it's easy to kind of ask oneself, okay, why do we have train drivers? I'm sure that train drivers are excellent people. They've got great training. I'm sure they're phenomenal in all sorts of ways. But at the same time, it's easy to kind of scratch one's head and think, okay, why do we still have train drivers? Please, somebody remind me, because we've had like robots. or computer systems driving trains for a long time, right? And I'm pretty sure that the reason that we still have train drivers is not because we cannot we because trains cannot be driven by computer systems. The reason we still have train drivers, I would venture to speculate, is much more subtle and complex than that. It's because of unionization, because of maybe passengers kind of fear that robots might go wrong and might crash the train. I mean, I'm not really sure, but I don't think it's because of the technology. And I think the similar kind of principle applies in medicine as well. The reason why you don't have autonomous diagnostic systems in radiology AI is not because of the technology, it's because of kind of far more subtle, intricate, and factors such as unionization, because of fear of patients, perhaps because of bureaucratic inertia. These are the kind of reasons why we don't have fully autonomous radiology AI systems. This is my personal view, and I know that I'm going out on a limb here, but a lot of people would disagree with me, but
That's yeah.
that's how I see it. Um, the other thing I'd like to say about radiology AI is that there is a sort of natural ceiling effect with radiology AI. With any kind of diagnostics, there is an upper level for performance, which is absolute, and that is like 100% diagnostic accuracy. Now, we've had the scientific literature has been full for many years, since the late 2000 teens of AI systems that could equal or surpass the performance of radiologists, even expert radiologists. So that concept has been around for some time. Now, of course, reporting those kind of results in a scientific paper is one thing, but actually seeing those kind of diagnostic and efficiency gains in the real world is another thing, right? That I understand. But nonetheless, I think that there is inevitably going to be a sort of leveling off of performance of AI systems in radiology. However, so it's easy to kind of think, okay, yeah, so kind of in a way, we are in a sort of mature market in radiology AI because they cannot possibly improve in terms of performance much more, right? And I think that is true. However, I think there are a couple of caveats to that. I think that there are still breakthroughs that can be had. And I know that providers of radiology AI solutions are working on, for example, making sure the integration into clinical workflows is smooth and these systems are usable and nice and the interface is beautiful. And of course, you at Carpal are, the kind of company that's helping that agenda along very nicely. However, so the question is, where might we hope to see kind of, paradigm shifting breakthroughs in radiology AI? This is a really interesting question. And
Do you think the radiologists would start developing their own AI going forward?
sorry,
Like,
say again, Shruti?
I'm saying, will radiologists start developing their own AI going forward? Do you see that trend coming in?
I doubt it because developing an a radiology AI system is highly technical endeavor that requires an awful lot of people. But I'd love to think that that might be the case. I mean, but I'd be surprised. A kind of radiologist, especially a radiologist on his or her own.
So right now, I think all of these radiologists who are sort of using AI, they have, data scientists and engineers
Mhm.
on the team, and they're also like with their, technical bent of mind, also wanting to sort of develop a few models. And we have seen a lot of use cases where they're developing models in-house, and then they want to use the Couple platform to compare it against commercial models, right? How their AI is performing. So do you see that becoming a trend?
Well, I'd like to think that it would be because, I think that that kind of competitive democratic pressure is nothing but good for, in this kind of field. But at the same time, it's difficult. I think that in all sorts of areas in tech, like big companies are just kind of mopping up, and I would expect, yeah, but I'm not sure about that. It's an interesting question. But
So we also have a person like and one of our audience who's asking that building AI is getting easier day by day. Do you think we'll get into a point where radiologists would rather build their own AI than using commercial algorithms?
Well, that might well be viable for kind of edge cases, like for niches, right? And I mean, I kind of, a fun project I have done myself in the last few weeks is to develop an LLM based on 19th century literature, right? There's a point here, by the way. My point, so, developing an LLM, that is a complicated process of coding, right? You have to get a lot of data together and you have to do a lot of coding. And so, this is, I mean, been doing scientific programming for a while since my postdoc days. And developing an LLM completely from scratch, it's one thing to tweak ChatGPT. It's another thing to create an LLM from scratch. Well, how did I manage to, a kind of basic programmer, kind of, an average level programmer like me, how did I manage to develop an LLM from scratch? Well, the answer is, what's called vibe coaching, right? So vibe coaching is basically just coding with the assistance of an LLM. So it's an LLM. So I used an LLM to help me develop an LLM, right? It's a very sort of mind-bending circular thing. So yes, I think this is one of the hugely important applications right now of large language models, and that is vibe coding and helping people to develop software or applications that would normally be way outside their capability. Or if we're talking about a proficient coder, helping them to develop products like 50 times, literally 50 times faster than they would have been able to do without LLMs. So I think LLMs are very, very important in terms of developing new software and new medical applications. So yes, I think that is something that would hugely help the development of kind of grassroots medical AI. The trick is really, it's not the technology, it's not the ability to develop these things. It's the kind of having the imagination to apply AI to a new problem, right? That's kind of really where I think gains can be made.
Right.
And so going back to 2021, this is when I developed, the first published system for predicting clinical trial results, right? Predicting clinical trial results is something that is basically never really done ever. And it's something that, that I was the first to do. I put together a little team of coders, like there were basically just three of us. And so we developed AI systems for making those predictions on data that's freely available. So yeah, I'm somebody who has myself kind of a grassroots level developed an AI system and applied it to a completely new problem in medicine, an important problem as well. So yes, I think I would expect and really like to see that become more important.
Yeah. And our next question from one of our audience is that what made you start the Medical AI podcast?
Well, okay, I the there's a bad answer to that question, but I'll just give it to you anyway. I mean, at the time I was working as an analyst with Informa, and I just thought it would be a nice way to attract a bit of publicity to our team. But no, I left Informa in 2024, and I've kept it going there, but just because it's, very satisfying for me to I mean, it's a fascinating field, which is the reason why I got into it in the first place, right? It is, and I think the thing I love about doing the podcast is that it exposes me to people applying AI in ways that you would never possibly imagine. And AI is such a it's such an important tool that can be applied in unlimited number of ways. So to see that being applied in kind of freaky deaky ways that you'd never expect in medicine, I think is a lot of fun for me.
Right. Okay. The next question is, if you could design the perfect conversation to move the field forward, who would be in the room and what would you ask them to debate?
Um, yeah, look, it would be Elon Musk for the reasons that I said earlier. He's somebody who has got huge pockets, and he claims to be developing and shortly releasing so-called the biggest product in the whole of human history right now. Whether that's true or not, I would expect that there is a good chance that Optimus is going to really not just move the needle, but just flick the needle off the gauge, right? And I would love to see that happen. I'm kind of, somebody who's super pro AI, and even though Elon Musk has also raised a lot of concerns with a lot of other people about the dangers of AI, and I think that should needs to be talked about. He is somebody with kind of the funds and the imagination, and to really shake things up in a way. I think part of the problem with the way that the conversation on AI tends to be had within the field is it tends to be quite circumscribed and it can sometimes tend to be bound within technologies which already exist. So people kind of think about, okay, so what's medical AI going to be like in, the next 5 or 10 years? And then there's an obvious tendency to try and project from current technology and current trends to 10 or 50. I don't think that makes any sense. I think you think about LLMs just exploded from absolutely nowhere. I mean, they didn't really, but it seemed like that, right? And I think that we will probably see like major paradigm shifts that nobody can really predict. And obviously, that's more true the bigger the timescales we think in terms of, right? So if we think about, what AI systems are going to be doing in the medical field in 20 years, all bets are off. It I mean, it's then we really get into the kind of realms of science fiction, and we can have a lot of fun with that. But I think it's
And
all
who
it's
else? Who
important to
else
think
other
about.
than Elon Musk in the room?
Um, I think I'd be interested to know what Jeffrey Hinton is thinking these days, right? Jeffrey Hinton, by the way, is first of all the so-called godfather of AI, and the reason he's called that is because he did a lot of early developmental work on neural networks. And back in the late 2010s, Jeffrey Hinton famously said that, by about, I think 2020, there would be like no human radiologists left at all because radiology is a field where, it's so ripe for AI systems to take over. And I'd love to know what he thinks about that now, because obviously in 2025, we're in a situation where there are still lots of radiologists. People are training as radiologists quite sensibly. There's no sign that there's going to be this kind of massacre of jobs within radiology. And I'd like to know from him whether he thinks that's due to the technology or due to kind of bureaucratic stroke political stroke cultural resistance, forces of resistance. Yeah.
Yeah. And our next question is, do you think using LLMs and generative AI for developing LLMs can distort reality with bias, since the users of LLMs aren't always domain experts and therefore have sketchy repercussions in the medical field?
Well, bias in LLMs is really about training data, right? So it's I think that I kind of want to say yes or no here, but I want I personally I think this is interesting because it comes down to what is basically a personality preference. I'm somebody who tends to be fairly risk averse. Sorry, no, fairly risk accepting. I'm somebody who wants to say to the people interested in the medical field, just I understand your anxieties. I understand the risks and the dangers, and they are real and they are present, but just go for it, because I think at the moment we are too risk averse. And I think this is a good example, So LLMs, of course, are biased. It's almost impossible to have any AI system that has zero bias. Because, I mean, what does that even mean? Let's say that you bent over backwards to build an AI system that was like super, super unbiased for your country. Then, okay, what about 10 years later? Your demographics might have changed. No, I mean, demographics in Europe and America are shifting very, very quickly indeed. So, bias, even you might build a perfect system, it's going to be biased within 5, 10 years, right? So you cannot have an AI system that has zero bias. So we have to accept a degree of bias. But of course, I mean, there are degrees of bias too. And again, where you draw the line, say that's acceptable or that's not is entirely a subjective thing. But obviously developers of AI systems they have a duty of care to build systems that are, if not unbiased, showing it as little bias as possible. But there's one other thing, Shrita, I wanted to add in there. There is a trade-off between goodness and bias. And we need to figure out, this is a philosophical question. We need to figure out, what do we want AI systems that are good, or do we want systems that are unbiased? Because in many, many situations, you cannot have both, you know. For example, let's imagine that you have your training data and you say, okay, I'm going to cut out loads of data, then I'll have perfect demographic representation in my sample. Okay, great. You've made your system unbiased, but you've also made it worse. Is that what you want? You know? So do you care about goodness for everyone, or do you care about uneven goodness for that's even better on average? You see what I mean? So it's a very tricky and philosophical question.
So, Felix, I think we are just, towards the last leg of our conversation. I would like to know from your, coaching experience, what are the most important things which you feel the medical professionals or radiologists, should learn to keep themselves abreast of whatever is happening in AI. It's just so much happening, and they are into their clinical practice every day, and they have to make sure that they train themselves on the latest of what is happening. So, what are your thoughts on this?
Well, I think that I would imagine that doctors should try and understand how their patients are using large language models. And apart from anecdotal evidence, my feeling is that adoption of use of large language models is pretty uneven. I mean, I still come across people who don't even know what large language models are, and that kind of blows my mind, right? But at the same time, that's obviously going to change over time, and more people are going to be, before going to their GP, they're going to go to Gemini or Grok or whatever it might be. I think and I think doctors need to understand um, how, what kind of experience that people are getting when they do that. Is Grok actually pretty good at diagnosing symptoms, from a description? And is it pretty good at giving advice on, I don't know, getting to, having a good night's sleep or tackling obesity, So I think that would be, I think that'd be a very, very interesting thing. And by the way, I don't think, I doubt, I mean, I think multimodal large language models are going to come in as well, right? They haven't really yet. I mean, we may not be very far away at all from being able to upload a photo of some kind of symptom and integrating that with a description of it. So I think that this is going to change pretty radically. I think this is a very, very interesting thing to watch, and I think this is a big deal. This could change quite dramatically how doctors do their work, or the kind of interactions they have with
I
their
had
patients.
a very, recent experience last week when I went to my doctor. She saw my report for just like 1 minute, and she had it online already on her phone before that. And she did not explain it a lot to me. And I was like, is there something which we need to sort of take care of? And she was like, I'm sure you must have put it on ChatGPT and you already have
Yeah.
insights. And I was like, no, I have not. I just collected my report and came directly to the hospital. And I want to know from you, what do you think? So it's already happening. And and after that, I started doing that. And I put all my reports on ChatGPT and then ask what's wrong or what's happening. So yeah.
And what did ChatGPT have to say about
I
it?
think it was very whatever ChatGPT said. I mean, I have a free version which I use, so it was absolutely correct in terms of giving me the advice for antibiotics and
Well, I
whatever.
hope your doctor took that as a compliment that you went to her first without asking anyone about any LLM about it.
Maybe that was that was what she was wanting to point, but it was pretty crazy, and I was like, no, I don't use it for medical advice till now. Happy to come to you, but yeah. Great. I think we have one more question from one of our attendees. What approaches can deal the false positives and to whom the model be responsible for?
So I didn't quite catch the first part of that question.
What approaches can deal with the false positive and to whom the model will be responsible for?
Okay, well, I mean, the problem of false positive. So look, let me try and interpret what that question means. I think probably what it means is, um, actually, no, I'm not. Okay, the question is not 100% clear to me, but I'm guessing that how can, obviously, okay, let's take LLMs as a clear example. Sometimes, um, it will give you a false positive, and in other words, tell you that you have a disease that
Yeah.
you do
How
not
can you
have.
deal, yeah, with false positives?
How do
Yes.
you deal with that? Well, I mean, I don't really know. That depends on all sorts. Like, I would imagine that Anthropic and Google and XAI have got good lawyers, because obviously, if I doubt those guys are ever going to get sued for some kind of malpractice related to giving false diagnoses when they don't exist, right? So there is that, but I think, I mean, this goes to a sort of broader question about legal liability, and that's a really complex one. That's for the lawyers, really. But I think that people are going to just get used to large language models and much more in medicine. I think that's already happening. Um, I think also, look, the problem of hallucinations and large language models is being addressed, right? So that's something which was much more likely to be an issue when ChatGPT first came out, as opposed to now, right?
Yeah.
So the makers of large language models have gone to great lengths to try and tackle that problem, because they know, of course, that that this can have like really serious impacts and can harm their reputation and can really undermine the usefulness of their products. I mean, there have been cases of lawyers, for example, who have been fired because they used very convincing case law in their work, which was completely hallucinated by a large language model, right? And I think there have also been similar cases of large language models that have just completely invented a disease based on the symptoms of somebody who was querying about their
Correct.
disease. So I mean, it's kind of, but I think we're going to see less and less of this, because the vendors of large language models understand that's a serious problem. But at the same time, this goes back to the sort of fundamental question about we have to get used to the risk associated with AI systems, especially in medicine. We tend to be very, very risk averse when it comes to medicine, and I think we tend to be a little bit blind to the alternative, which is the like we never ask ourselves the question about, what do we do about the problem of false positives from human doctors? We never ask that question, right? We just deal with it and accept it. And so I think that if we're going to be fair and even-handed, we should treat the human doctors and the medical AI systems kind of like the same, and then we will have a sort of fair comparison to base choices on.
Right. No, absolutely. I think this is one question which everybody's trying to answer, that if there is a false positive, then who should be responsible if the model gets it wrong? Like, who should be
Right.
responsible, especially in our field of having platforms and model developers and then end users. So that always remains. Okay, I think thank you so much, Felix. We are at the top of the hour, and I'd like to thank you for taking out the time for being at on the Unboxing AI webinar. It was
It's been
great.
a pleasure, Shruti. It's kind of novel for me to be on the other end of the microphone. It's
Yes.
quite fun.
Now on the live webinar and not on a podcast, I think that's also different. So yes, thank you so much for doing this.
Thanks, Shruti. Bye bye then.
Thank you. Thank you, everybody. We'll see you next week, same time on Unboxing AI webinar.